that the size that you asked for is going to be what your end result is, because it doesn't happen.
I stumbled across this video and I agree with everything she said. So go back and listen to Jackie's video. She's basically talking about when you have a breast reduction, you may not get the cup size that you came in asking for. As a plastic surgeon, I always want to give patients exactly what they want, but there's a lot of limitations in surgery that are going to limit my ability to do that. So first of all, there's no standard cup size. There's no standardization here. So we tend to talk in volumes for plastic surgery. So I remove a certain volume of tissue from a patient. So if I remove 100 cc's from one patient, it might take them down a full cup size. Whereas in another patient, if I remove 100 cc's, it could only take them down a half of a cup size. Another issue is I'm limited with surgery. I cannot just do anything I want because I have to be respectful of the tissue's blood supply. So all of the tissue in your body has a blood supply, and that is what's bringing the food to feed it. And if I don't respect that and leave enough of that behind, the tissue that I leave will not make it, and that's a terrible situation. So the tissue that's left behind in a breast reduction is called the pedicle. And at the very end of the pedicle is your nipple. So if your nipple is very low, the pedicle might be very long, and I'm limited with how much tissue I can remove. So it's really important to consider these things and talk it out with your plastic surgeon so you have a good idea for what's possible with you. Now, we always ask patients, what cup size would you like to be? And that's not because we were promising you that cup size. It gives us an idea of what your personal aesthetic is. So in general, when patients tell us they want to be a C cup, that's usually a patient that wants to be proportional, the same size top and bottom, so size medium and medium. If you say you want to be a B cup, that's typically a patient who wants to be a bit smaller than proportional on top. And then for D cup, the opposite, a little bit bigger. And I always clarify with my patients. If they say D cup, I clarify just what I said here and make sure that's what they're saying. So when we ask you a cup size, it's really just a starting point for the conversation so we can figure out what exactly you want and what your aesthetic is. It's really important to look at different before and afters and focus on the proportion. You want to try to find people with bodies similar to yours that ended up the proportion that you want. And that's what we can shoot for in the operating room, a certain proportion. We can't shoot for a cup size. So I always tell my patients that I'm going to do my best in the operating room to shoot for the proportion that they want. And then when their body heals and they're ready to be sized for a bra, believe the nice lady and get the right bra that fits you. And don't get too concerned with what that cup size is, because the most important thing is that we did a breast reduction. We're going to relieve your symptoms of back and neck pain. We're going to help you be more functional in your body and get you closer to the proportion that you want. So I think that's the healthiest way to look at it. But yes, as a plastic surgeon, we often can't give you the exact cup size you ask for when you're having a breast reduction.